Members of Parliament's Portfolio Committee on Health want Minister Joe Phaahla to provide a detailed response on the National Health Insurance Bill. This follows a meeting with him just this week. Committee members expressed differing views and say they want the minister to give a proper funding model to ensure the NHI is equitable. Well, for more on this, we're joined now by the committee's chairperson, Kenneth Jacobs, who joins us virtually from Wellington in the Western Cape. Kenneth, thank you so much for your time this evening. This is a very serious discussion, and indeed, the devil is in the detail, and that's the detail that your committee wants. Yes, the idea of a universal coverage for everybody is wonderful, but how exactly will we be able to fund it? How will we build it? How will it work? What were some of those differing views within the committee on this NHI bill, which is finding its wheels turning yet again?
Good evening, Marcel, and good evening to the viewers, and thank you for having me on your program. Yes, there were indeed different views expressed by the different members of the committee, but we must understand that this is a multi-party committee and that we differ ideologically and also in terms of the need that is seen to be in terms of healthcare, wanting to bring quality healthcare to all the people of South Africa. And the committee members do not seem to have the same view with regards to the need for the NHI. In terms of the funding, South Africa already spends close to 500 billion rand annually on healthcare. The thought is that it needs to be restructured because we have the private healthcare and we have the public healthcare, and we do know that 16% of people of South Africans who access healthcare actually access the private healthcare, which spends about 50% of the total spend of funds on healthcare in South Africa currently. So we're coming to a close on the work that has to be performed on the bill itself. What the minister was talking about is that it's not going to be an immediate implementation. It's going to be a phased implementation, because he also mentioned that they're busy with the construction of the needs for the NHI within the National Department of Health. So the understanding really is that it's going to be put into place over a period of time, and it's not going to be immediately we wake up and it's going to be NHI.
You mentioned... Sorry, please do go ahead. Your signal paused. Please do complete your thought.
So there's going to be ongoing work in terms of making decisions with regards to the need of funds, and I think that's what he generally meant, but definitely not on the implementation of the bill, of the work that has to be done by Parliament.
Well, speaking of those funds, and you mentioned earlier about the hope being, or the plan being, that the pool of funds put together would be enough to cover what they're expecting the NHI to cost. The big elephant in the room is the role of those private medical aids, which I'm sure you will agree with me are pretty powerful in South Africa. Some of the biggest corporate businesses and entities and influences that the economy has. Is there a question about whether this can go ahead with or without our formal medical aids?
Well, the thought is that we start implementing, and over time there would be not be a need for medical aids anymore. That as public health is grown and as the use is being taken up by the people of South Africa within the NHI, that people wouldn't need to pay contributions to the medical aids over a period of time. So that period of time, I think it's where we will see how that really plays out.
Would you agree that based on the engagement that you had with members of the public during that engagement process and during this process, that there's a deficit of trust that is almost a golden thread to these ongoing debates and discussions about NHI. That if you look at how government has managed, or not managed, some would say, the National Health Department, specifically now with reference to how we went about servicing people who needed healthcare with regards to COVID-19, that there's a deficit of trust in that people are saying, well, look what they did with the health department. We've got no faith that this government would be able to run an NHI successfully, even if it's got its best intentions at the heart of it. Is that an issue that nobody perhaps is wanting to talk about or call a spade a spade?
That's not really so. You know, we had the public hearings in the provinces, in the 9 provinces and within 4 districts per province. And there we had 931 people who had verbally given their understanding of the NHI. And the majority of those people were saying that they wanted the NHI immediately. In other words, they were saying, we really need to get better health care within South Africa. Yes, on the other hand, there's a group that is saying, we don't really need this better healthcare because we already have it. And that's probably maybe the group that you're talking about. We have received over 338,000 emailed and written submissions on the NHI Bill. And as you know, we also had many virtual engagements with those who wanted to make oral submissions to the portfolio committee. And that's a vast number of people who had shown interest in this. And the majority of those people were saying that we understand that we need to be able to give all the people of South Africa access to quality healthcare. That is the underlying important point to really understand in the context of the NHI in South Africa.
I don't think many people would disagree with that statement. I think the big question is about the South African government's ability to be able to run something as big as this. I mean, just yesterday, I spoke to the chairperson of Treatment Action Campaign, and she says that South Africa's National Health Service, or South Africa's National Health Department, or public health, is not in crisis. She says it's non-existent. It's being completely destroyed. And she points specifically to stories like what's happened at Charlotte Maxeke Hospital. We've got the Rahima Musa Hospital where, doctors are speaking out saying that because of blackouts or because of the lack of resources, children are dying. And the list goes on in terms of these kinds of allegations, not just allegations, there's proof of it at our public hospital. And my question is about whether stories like that, very real stories, and the few that we know, because there are probably far more, isn't putting a very major question mark over whether this government has the ability to pull something as big, as important as this off.
Yes, it is so that we've seen in the media, we've seen also at the portfolio committee, we hear of these many stories. We've also been to the Eastern Cape, to Nelson Mandela Bay, where we do see that there is a need for revamping and investment into the public health and into facilities and into the provinces. So we understand that there is, if people want to call it a deficit, maybe in terms of what is being supplied at the moment and what could be supplied in the future. And we are of the view that if all of these monies were accessible to the use of all people in South Africa, that it would have given us a different picture. So over time, our population has grown. We also have many reasons why we have such a huge population, but we haven't really grown in terms of the fiscus, because we also understand that the fiscus is very challenged at the moment. So clearly there seems to be a deficit between what we're getting in and what we're spending, and that we really need to find more money to be able to improve the public health system.
Yeah, and I suppose the big concern is that the money that is being spent, a large amount being spent on the health department, isn't being spent where it's supposed to. It's being spent and services aren't being rendered. But that's a conversation for another day. Thank you so much for your time this evening. The chairperson of the Parliament Portfolio Committee on Health, Kenneth Jacobs, joining us live there from Wellington in the Western Cape. We thank him for his time.